Hi dear doctors, welcome to 𝗲𝗵𝗵𝗵. Myself Dr. 𝗵𝗵𝗺𝗺 and I'm your pediatric faculty and mentor. See, the topic of discussion for today is Hirschsprung disease, and Hirschsprung disease is actually a congenital disease. Okay, so it's a congenital disease, congenital motor disorder, right? Why does it happen? It happens because there is failure of neural crest cell migration. So, you know from your basic knowledge of embryology that there is something which is called as neural crest cells, and these neural crest cells are failing to migrate, okay, and because they are unable to migrate to the proper position, there is an absence of enteric ganglion cells. So what happens is, if I just tell you that you have got something, so if this is your gut, you have got some cells in this gut, and the plexus, okay, the plexus of ganglion cells, which is actually called as Auerbach's plexus, okay, Auerbach's plexus or Meissner's plexus, Auerbach's plexus or Meissner's plexus, right? So if the Auerbach's plexus and the Meissner's plexus is absent, what does this mean? That there will be no stimulation to the gut, okay, there is no stimulation to the gut. Now the gut is not going to contract properly as it used to be, alright. So I'm telling you once again, so what happens is that it's a congenital disorder where the neural crest cells are unable to migrate. So can you see U and N coming together? So U for unable to migrate. Who is unable to migrate? The neural crest cells are unable to migrate. So it's a congenital motor disorder of the gut due to the failure of neural crest cell migration, absence of ganglion cells. And because there's an absence of ganglion cells, what happens is that there is obstruction. Which type of obstruction? Functional obstruction, okay. So rectum is always affected, okay, and the aganglionic segment is unable to relax properly, okay, it is unable to relax properly. That's why there is a functional obstruction, okay, and of course there will be proximal dilatation, that is called as megacolon. Let me just show you this. So what happens, for example, this is the normal lumen of the colon, and what happens is, supposedly this entire segment goes aganglionic. So if once it is contracting, it is going to be in a sustained contraction only, okay, and it will not be able to relax. So what is going to happen? This is the proximal part. This proximal part is going to have what? It is going to have dilatation, and the dilatation of the proximal part is called as megacolon. The dilatation of the proximal part is called as what? It is called as megacolon, okay. So rectum is always affected, okay, and there is aganglionic segment that cannot relax, and because it cannot relax, there is functional obstruction, and of course there will be proximal dilatation that is going to happen, okay, and this is called as Hirschsprung disease. Coming on to epidemiology. So remember that Hirschsprung disease, H for Hirschsprung disease, H for he. So he means that it is more common in males, okay. Now one more thing is important, that is what is the gene associated. So it is the Rett proto-oncogene mutation, okay, Rett proto-oncogene mutation. So this R is something helpful to remember, the Rett proto-oncogene mutation. Association. So Hirschsprung disease, H and then D for what? D for it is associated with Down's syndrome. Hirschsprung disease is associated with Down's syndrome, trisomy 21. What happens is, of course, because there is a functional obstruction which has occurred, okay, so because of this functional obstruction, there will be a failure to pass meconium, okay, so failure to pass meconium in first 24 to 48 hours. This is the earliest manifestation, okay, this is the earliest thing. So earliest thing is failure to pass the meconium. When the child grows old, of course, there is chronic constipation that is going to occur, there is intestinal obstruction that is going to occur, the abdomen will be distended, and vomiting is going to be there, maybe bilious vomiting is going to be there. Clear? Very clear? Now, what are the initial tests you are going to do? So you do a rectal biopsy and you see that there is absence of ganglion cells, okay. So the gold standard, now biopsies can also be of two types. One is called as suction biopsy, other is called as full thickness biopsy. Other is called as what? Other is called as full thickness biopsy, and full thickness biopsy is gold standard. Full thickness biopsy is what? It is gold standard. Okay. So again, if we see what are the histopathological findings, there is absence of ganglion cell, there is hypertrophy of the nerve fibers. Although there is hypertrophy of the nerve fibers, but they'll not be able to, maintain the relaxation, because it was more or less being maintained by the ganglion cells, the Meissner's plexus and the Auerbach's plexus. So because there is hypertrophy of the nerve fibers, there is acetylcholine esterase activity which is increased and calretinine staining is decreased. Nothing more to put your brains into, just learn this fact that calretinine staining is going to decrease, acetylcholine esterase activity is increased. Okay. Other thing, what imaging studies you can perform, of course that's going to be something supportive in order to see that some other obstruction is not there. So we do a contrast enema. Okay, we do what? We do a contrast enema that is going to show you an aganglionic distal segment and dilated proximal colon. What is the treatment? Surgical resection of aganglionic rectum. Okay, first of all you resect the aganglionic rectum and you do a low rectal anastomosis with normally innervated bowel. Okay, are you getting it? So this is something you are supposed to do. You cut the segment which is having the aganglionic part. Okay, suppose this is the segment having aganglionic part and this is a normal segment. So you just cut the segment which is having the aganglionic part and you do anastomosis between the parts which are normal. This is done by pulling through both the ends, so it is called as pull through procedure. Okay, temporarily what you can do else is diverting colostomy if severe enterocolitis is there. Sometimes the entire colon is going to show some inflammation, so this is called as enterocolitis. This is called as what? This is called as enterocolitis. So that's why what we do, we just remove this part and we do an outpouching from the skin. This is called as colostomy. Okay, this is called as what? This is called as colostomy. So diverting colostomy is also done if if the segment ahead is inflamed or something like that. So eventually what happens is, can you see, suppose here is the obstruction, suppose this is the area of obstruction. So this part is dilated, the proximal part is dilated and the distal part, the proximal part is something that is going to show you dilatation and the distal part is going to show you what? Distal part is going to show you contraction. Okay, so this is the case of Hirschsprung disease and this is it about our today's lecture. Thank you so much for joining. We'll see you in the next class.